Now there's a treatment for lumbar spine disease, artificial disc replacement. Most of you know, probably watching this video, that artificial disc replacements are very common in the neck. And there are 9 discs already approved in the neck. But what about the low back? The low back, we have 3 discs that are FDA approved. One's already off the market. That leaves 2 discs, prodisc and activL disc. Both have great results compared to fusion. I have 3 artificial discs in my low back. At the top 3, lumbar 1, 2, 2, 3, 3, 4. My bottom 2 discs, L4-5, and the very bottom disc, L5-S1, are fused. I didn't want a fusion. I wanted an artificial disc. However, I could not get an artificial disc at L4-5 because my vein was too scarred in from my early surgeries to move over. L4-5 is the tricky one that you need a good approach surgeon, the guy that gets us in there, to move the vein over to get us to that disc. And my vein was too scarred, and so I had to have that disc fused because you have to put an artificial disc in directly through the front today. So I couldn't move the vein. Now L5-S1, I did get an artificial disc put in actually 14 weeks ago. And I had a very rare complication. I've only seen it 6 times, so of course it happens to me, where I subsided or collapsed my vertebrae over the disc. The reason is my vertebrae are almost 6 centimeters wide, and the biggest disc they make is 4 centimeters wide. So it's too small. My vertebrae crushed over it. I'm 6'4", 235. Crushed right over the artificial disc because your bone is softer than titanium. Pinched my nerve on the left. My partners had to take out my disc, fuse it, and put new screws in my back. And that's 12 weeks ago. I start exercise this weekend after my 12 weeks of waiting for the fusion to heal. But I did not want a fusion. I tried my artificial disc. It failed, and I got the fusion. I think the point is this: if you get a fusion, there's no going back to an artificial disc. If you get an artificial disc, you can always get a fusion if it fails or something rare happens. I would say 98% of the time, discs work great. The discs last 70 years in the low back, and you'll be fine most of the time. It's rare we have complications like I had. But it happens, and particularly complications happen to guys like me, who are the doctors who put them in. So life's still good, and I'm still having fun. So there is life after artificial disc replacement and an eventual fusion if you need to have it.